Hi guys, this week me and Amber did eating disorders and obesity for our topic. Eating disorder causes, um, because of pressure placed on girls from advertising, fashion, and entertainment, which promote an idealized view of the female body, that the female body should have to be perfect. This contributor is one of the leading ones to girls having eating problems such as disordered eating, binge eating, bulimia, and anorexia. Girls who are perfectionists that play sports, are organized, do well in school, and then suffer a loss of a personal relationship such as family or breakup are more susceptible to developing some sort of eating disorder. Types of eating disorders: we have anorexia, which is an excess worry about weight gain. They often starve themselves and restrict what they eat. Avoidant restrictive food intake disorder. This includes food aversions, picky eaters, or people that have no interest in food at all. Binge eating disorder, overeating, unable to stop eating, and then that sometimes lead to restrictive eating. And then bulimia is overeating followed by self-induced vomiting. Even though most connections of eating disorders are made with females, there is a rising number of males who are being diagnosed. The definition of disordered eating is a generalized condition that refers to individuals who are preoccupied by the size and shape of their bodies and limit their eating and or engage in compulsive exercise. Eating disorders and obesity can overlap. Eating disorders affect your health, your emotional development, and school performance, and they can be life-threatening. Some statistics: between 3.3 and 0.4% of young women and 1.1% of young men will suffer from anorexia. Research followed a group of adolescent girls for 8 years until they were 20. 5.2% of the girls met the criteria for anorexia, bulimia, or binge eating disorder. And then 13.2% of those girls had suffered some form of eating disorder before the age of 10. And then for Afrid, in a group of adolescents with eating disorders received treatment in a clinic. 14 of those met the criteria. It's younger children and male mostly, and symptoms: food avoidance, decreased appetite, abdominal pain, and fear of vomiting.
What to monitor for as a teacher: eating disorders, being aware of the warning signs and how to best help these students. The warning signs are rapid gain or loss of weight, withdrawal from friends and activities, frequent requests to go to the bathroom, dental problems, bad breath, and hair loss. Obesity facts and other important information. A growing number of children and youth in the United States are overweight. These children can experience multiple health problems such as diabetes and experiences of lack of energy, teasing, stigmatization, and discrimination. Causes of obesity. Some children have medical conditions which make them susceptible to being overweight, poor diet, and then sedentary lifestyles, which means that the child is spending more time on technology or television than being physically active. Effects of obesity causes learning, socialization, and self-esteem problems, as well as depression. In the classroom, instead of focusing on the size of the student, weight loss, or diets, as the teacher, you can promote the acceptance of different body types. You can also emphasize and model healthful lifestyles, eating and exercise as a means to feel better and have more energy, collaborate with medical and psychological professionals, which includes family physicians, dietitians, school counselors, nurses, and social workers, as well as their family members, to implement a comprehensive program which can address related issues as well as support healthy eating habits. In the classroom, for both, you can reflect on comments, behaviors, and attitudes regarding body image, model healthy attitudes and behaviors, teach students how to critique messages from the society and media, make sure students are not ridiculed because of their bodies, make sure you observe and document behaviors, and have positive talk about body image and about food because of the guilt and other emotional factors with eating disorders and obesity. Telling a child that food is not good or bad for them could make it even worse.